Hey, how's it going? I'm back here prepping and looking around in the lab section. Let's see, was there anything? My chair is so creaky, makes so much noise. There we go. Oh, that went totally far. Do I have it down? There we go. Pop that right out of the thing. My kids are right outside the bedroom windows or the office window here, so they might make some noise. They're just outside playing. It's still sunny here in Arizona. Not late at all. I was wondering if you guys noticed this E&M medical decision-making chart they had in the back of Lab and Path. It's on page 614 if you're in the 2022 CPT book, sorry. They have this whole medical decision-making chart all over again in the Lab and Path section. It's still based off 2 of 3. I wish they redid this chart for 3 of 3. I don't know what differences it would really make, but it would be interesting to see the differences in these. But, yeah. But look, it's lab codes instead of our E&M. But it still looks a lot like our MDM one that we have in the front. But it is Lab and Path. Hey, Go-Kart, how's it going? I'm doing great. Had tutoring first thing this morning. It always goes really fun. Had a good time. We did some musculoskeletal questions, and then after I got off with her, I decided to go find some more musculoskeletal questions and do a part 2 tonight. So hopefully she's still up and is working away and would want to see some more questions. Is that Betty on? She's been awfully quiet today. I wasn't sure who all was around, but it's good to see everybody. Thank you for all the likes. But has anybody ever paid any attention to this? MDM medical decision making for the Lab and Path area chart? Hey Jillian, hey Annie. It's good to see y'all. If you like medical coding, stick around, because I've got some practice questions. We don't have any questions regarding 80505 03 04. 3 or 4 laboratory path findings, 1 or 2 laboratory path findings. I'll have to be on the hunt to look for some. Some of these with the E&M, yeah, 2 out of 3 with E&M codes with one of these codes. I wonder if we can build those codes together. That would be interesting too. Yeah, we'll kind of do some research to see what's going on with this chart and how we would use it. It's the same thing. Look, moderate risk examples, prescription drug management, and all that stuff. It's like, okay, it seems like the same exact thing. Very interesting. But I was just pre-prepping the lab and path section. I don't even remember that being in the 2021 book, but, you know, it was a year ago when I did the book. I'm not quite sure. And usually the green font is new, and this is green font, so maybe it's just new for this year. I'm not sure. I haven't compared it yet. Haven't went that far. They're new for 2022. Nice. Very cool. I'll do some more research on them and see what's going on with that mess. But I've been just going through, highlighting what's in the parentheses, doing the out of code sequencing nightmare that's going on in here when I can't do any more of the musculoskeletal. But I'm still really working in this musculoskeletal section. Of course, I just got to write our one-word differences. I've got our open and closed procedures marked, our do nots, and something I've implemented during this section that I think I should go back and do throughout the entire thing is when it says without something, I'm leaving the word without, but I'm going through and marking out whatever freaking word it is. That way I don't misread, you know, that the difference there, that this doesn't even have manipulation in it. So I put one line through it. The proper medical way of doing something, just put one line through it. That way I know it's not in there, just not. So don't even go there. It's not there. That way I can make sure that I don't confuse it with something that might inadvertently be there. I did it right here on anything that was without. Not every question has withouts, but when it does, I'm just going through and getting rid of it. We don't need it there. I don't need that word there. It's not even in that CPT code. Why have it? I'm marking my modifiers. There's a lot of those in this one. Thank you for the love. Thank you for all the hearts and taps. What state requires coders in doctor's offices? I don't know, Suzanne. You tell me. What are the best highlighters to use? Push button. I love push button. Because that way I don't have to keep up with the cap and remember to put it back on. They do write a little wet and can wrinkle your page a little bit because so just go over it really lightly. Don't put any pressure because it does get the paper pretty wet. I'm not sure if that's every kind of highlighter does it, but my favorite, of course, is always the push button ones. I have the capped ones, but I like the push button ones, and you can get them in all different colors and all different brands, of course. These I got during the school year in August. You can tell I've worn the black off of them. But I don't have a particular brand except for cheap. So when school season starts, September, October, they start putting out a lot of coupons. And then when school starts and they have leftover stash, come October, I'll use those coupons finally once the school supplies go down to like, $1 each pack or something. And then I'll put the coupon on them. And I got all these for free. These Sharpie ones, I only paid tax or something. It was really crazy. So there wasn't a lot I had to pay for those. But I love push button. That way I don't have to keep up with the cap. Love it, love it, love it. But my pens have to be Sharpie and they have to be ultra fine. So if you're ever doing different colors like I do with all the rainbows and stuff, I only use the ultra fine, because I don't have to start the ink. It already is good and going and flowing, and it doesn't bleed through too bad on the other pages, because these pages are super, super thin. So I like the Sharpie Ultra Fine. Those are the only ones that I'll good. Lots of people use different things, whatever works for you, but these won't bleed, and they don't. I can write on the book and it immediately dries too, so I'm not smudging things all over the place. So I like those. Those dry really, really quick. Plus, you can, when your ink pens do dry out, all you got to do is give them a little dunk and some of that. Just one little quick dunk. Just drop it and then bring it right back out really, really super quickly, and you'll get another couple of weeks of ink out of them too. So, oh Lord, you enrolled in a school. Well, good luck. Lord help. I like to teach self, to do the aapc certification for medical billing and coding. You don't have to go to school, so you can self-study. So, but hopefully you got a grant or something, and maybe it's the community college and you didn't have to pay for it. That would be ideal. I just hate seeing people spend a lot of money on courses, because it makes me nervous. But I'm here to help, absolutely here to help whatever way I can. The main things from your course that you're going to need, they're going to throw a lot of information at you. You can't learn an entire career's worth of coding during your course, but your practice questions for every chapter review are going to be your bread and butter. That's what you should practice. That's what you should keep up with. That is what you should work on your weekends and downtime, instead of all the reading and book work on that. I know, Lori, yeah. I wish I know about the enrollment in college. Some of your states are now finding ways to release COVID money that they didn't know what to do with, and they have surplus. Check with your local state websites to see if there is any, even county websites. Like I live in Mojave County. Check that site to see if there's anything left over that they're giving their citizens for anything. Sometimes it's just to ask somebody at your state or your county clerk's office, and you might be able to get something back for sure. I know they sent a letter here wanting to know how many people were in our household, so that they could send us some money per person that's in the household. And we're like, really? Okay. But it's just county money, not federal money. So I don't know. Yep, got to learn those guidelines, especially the top guidelines for diagnoses. I'm taking your CCS exam through Ahima, so I will be stalking your page. That's awesome, Sydney. We just had somebody pass the CCS exam who's been with me for a while. Who was that? Christina? Somebody. Charlotte? Trying to work. All the names. Who was that? This is her. Christina. I was right. Christina just passed. That happened day before yesterday. So, yay. Got to hook up with her. See how she did it. I ordered the pens with the eraser and hope they work good. Hope so too. You don't want something that you got to write really hard on. You want it to flow really, really softly. Because if you have to put pressure on the ink to make it flow, these pages are so thin. You're going to see you're going to make physical indentations in the paper. And when you flip it over, you're going to see and feel the indentations from the ink from the other side on this side. So whatever the ink is, just make sure it flows with a very light touch. You don't want to be pushing down hard at all. So that's one tip. We do. We need more coders. CCS is, they do like medical coding and billing. They need to know more payment methodologies. It's just the other nationally recognized medical coding certification company. I don't believe there is known as aapc for the doctor's offices like CPC is, but it's their version. They have a CCA version, which is a smaller version that's a little bit not as big as CPC, but it's beginner coding. And then their CCS is more difficult. It's got payment methodology and some billing stuff in there too. They're really technical with that CCS. You only get one try per certification with them, so you don't get the 2 tries with ahima either. So that's why I liked AAPC, number one, as I chose that. And if you look through like Indeed or other jobs for medical coders, you'll see CPC listed more often than CCS, but CCS has that extra billing kind of component in it, and it may increase your pay rate a little bit if you have that. I'm not certain. Depends on what you can push and what you can ask for. So. Oh, wow. Nice. Hold on. What is Betty saying? Connor. Hey, Connor. It's good to see you. It's been a little while, huh? Took a break from my books and just finished my college class. Ready to get back into it. Betty said Farrell Nikki passed her CCA today from Miami, and she may be in our local news. Aw, that's so cool. I did take Certified Billing and Coding Specialist from the National HA, right? That, I've heard of that, but I don't think they like register you for a certification to make you take continuing education to keep your certificate. That's the difference, I think, in AAPC. Not sure. Hold on, let me go fuss at these kids. Y'all go outside and play. This ain't. Hey, Mommy. Can you ask Elijah? No, James, I can't. I'm in the middle of a live. I'm in the middle of a live. You take your friends outside. Out. Out. Out of the house. Out. Out. All the neighborhood kids just come into the house, and I'm like, out. All of you, go. It's a beautiful day in the neighborhood. Go outside and play. See, we still got sun out here, so go out. Y'all don't need to be all up in my house making a mess and being really loud. Go play. Go out there. Our coder jobs are all getting offshore. No, Walker. There's tons of jobs here. We need people to work for the health plans. Cigna, Blue Cross Blue Shield all need coders. Heck, CVS Pharmacy even hires coders here in the United States. They have jobs posted on their website right now. Now, stop it. Get out. Outside. Go. They're still in here screaming their heads off. Let's see. You know, if they do send out their jobs to India, a lot of times my group shut down our billing department, retired everybody, shipped out our billing to a service. I'm not sure who they used for billing and coding after that. We lasted a year and then we were back. We rehired everybody back into our billing department. So there is advantages to having in-house and local billing services. So don't worry about that. I wouldn't worry about that. There is always a position for you. You can even go to work for the companies that make medical record charts, the electronic medical charts. They need coders to help them search, work, and promote their product. They need super users, people that can code but can also use their EHR system with their eyes closed and can show other groups how to use their product once they purchase it. There's a lot of jobs for medical coders. You just need to think a little bit outside the box. The surgery centers, same-day surgeries, plastic surgeons, also ambulance services, helicopter services need medical coders to get reimbursed. You'd be surprised, even your local fire department needs a medical coder because they got to get paid too. All right. She's celebrating today. Look at chat. Aw. I just got my first coding job. Cuckoo. Oh, nice. It's her third week, and I did mention you in my interview. No, you didn't. Oh, my gosh. That is so cute. I've got a hospital I know in, is it Tulsa? That I helped like their entire department get their CPC, and now they're all going for their COC or CRC. So that's super fun. That's nice when the company knows me. That is so cool. Congratulations. Yep, we've had tons pass for sure. It's been such a fun year. It has. And it's been one whole year since I've started making TikToks and trying to help people like this 3 days a week. So it's been one whole year. So that's super fun. Super fun indeed. Indeed, indeed, indeed. Okay. Rapid fire. How are we going to code an established patient with a written RX and labs were sent? What level visit are we? What level visit? Anybody want to guess? Anybody want to guess? It is a 213 because the RX written was just for 7 days. It wasn't a life altering. Look at Maya. It wasn't a life altering. And Maya, you might be right. I just have to go look up that E&M chart back there in the lab section to see if you're right. But I have no idea. I haven't worked up those new codes yet, so I have no clue. But I'm talking just regular E&M. Front of the book are 99213s, 212s, 214s. What would we code a patient who's established with a UTI? All we have is an RX was written for 7, assuming it's all related, that it is just for their 7 days. If we wrote them a prescription for 30-day prescription, we would definitely be at the 214. But since it's supposedly, hopefully, written just for the UTI, it's going to be a 213. What about a new patient with diabetes, has a sore throat, culture was sent, rapid test was positive in the office, and an RX was written? What level visit are we with that one? I'm sorry about it skipping. Betty's got it right. 204. What about an 18-year-old wellness who wants an IUD placed today? What level visit would you do? Number 1, we need to know, are we new patient or established? But this is the only info we have. So would we code them new or established? I'm sorry, Megs, or me giggles, even though I call you Megs every time. I wonder why my internet has not changed. We are still rocking a good internet. I'm not having any hesitation on my end. So sorry. I guess we'll know. Yeah, my battery is completely full. I haven't done anything with this phone today except for tutoring this morning. For our 18-year-old wellness who wants a IUD, are they new or established? How would we bill that? We're going to bill them established, right? Perfect. Yep. Established is our default. Default. Okay, let me put this away and my book away, and we'll get started on those muscular skeletal questions that I have. If Diana is on, these are going to be different questions than what we tutored with this morning, by the way, if she's on. And I made up some anatomy questions all on my own, too. So we got some questions that I did. Let me get up here. Squirrel ruptured. OT. Little anesthesia. But these are all musculoskeletal related. Get to the one that I started with. That is new. Oh, there it is. Okay. All righty. This one I did with her, I think. Now that I'm looking at it, I think I did this one. Okay. Yep, we're keeping A and D. Very good. And all they want to know is if we're adding this radiology or not. Where are we going to find the answer? Yep, we're going to go to our 27096. It has a ton of parentheticals too, which is super nice. But our CPT code descriptor says it includes fluoroscope. There's one interesting thing I wanted to show y'all, and I think it is at 20611. If we go there, 20611, I think. Yep. 20611 happens to be ultrasound guidance. And then the 27096 is fluoroscope guidance. So kind of interesting that they picked that 20611. It's not the correct answer, of course. We are doing fluoroscope, but it is an insight into some of these codes that we know we're excluding because of the process of elimination. But I still like to go look and see what they are when I'm not in a testing, environment. I still want to see what the codes are that they picked to put up against the right code and look to see why they did that. So this one is an injection too, but they're using ultrasound guidance with that one. The 20552, I don't know. Oh yeah, that's just right here. It's got no guidance whatsoever. And you don't count the injections, you just count the muscles that are involved in this one. So no guidance on this one. And then this one's fluoroscope is included. So that's just interesting. I like to just go see what the differences are too, but clearly the example was just knowing whether we were able to bill radiology on top or not. And we know if we look at our code, we don't, it's included. So we can just pick D and move on. The other thing I did was for the 27096, by the way, before I go, I marked, you see where it says the name of the joint? It says the SA whatever in the CPT code descriptor. Well, they called it an SI joint. So above it, I wrote AKA SI joint. Just to find a word or something from the CPC exam question that I could add into that CPT code that is the correct answer, that will help me the next time I see it, if I do see the CI. Celestone and Marcaine are just steroid injections. We often use them in bones and joints. We also use them in musculoskeletal because we would give shots with this with Benadryl mixed in it. 2 types of steroids with Benadryl in the butt cheeks would have you feeling great for the next 2 weeks after you slept for the next 24 hours. For allergies and for the next 2 weeks. It's called a sinus cocktail is what we called it in the South. People would come in and get one of those, and you've got about 15-20 minutes to get home after that sucker before that Benadryl kicks in and puts you to sleep for a good 12-hour sleep. And once you wake up, your allergies will be pretty good for a couple of weeks. It was great. I loved the allergy injections. Hey, Tammy. Aw, thanks. Trigger, trigger, trigger. Yep, they're trigger injections. Yep, 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 yep. Don't believe anything they say, Tammy. Betty cuts her sandwiches in squares, just so y'all know. All right, let's go down to our next question. Let's see right here. What would we do here? Little tiny 4 square squares. All right. What's going on at this 24579? 24579. That's what I would go to first, just to see what's going on. Yep. I've got them locked out of my room, Tammy. They're in the living room. They are playing with some neighborhood friends that came over. So I've got about 5 or 6 12 to 13-year-old boys trashing my living room right now. All right. 24579. I'm getting distracted. 24579. We got open treatment of a fracture, maybe? A fracture. I've got one that's 30 in there too, so it's fun when they're older too. Just as sweet, just as nice. Boys are great. All right. Don't forget, just because your fracture might be opened or closed doesn't mean your procedure will be open and closed. There's distinct differences in these. Don't let them confuse you on some of that. So what do you guys think here? We are doing an open procedure, right? So we can definitely get rid of which ones? Our 77 is closed, right? Oh yeah, cast is always bundled. Absolutely. Absolutely. We have differences between the A's and B's, which can be super easy to figure out. S42 would give us the definitions of both of those. Let's see. So would we even have a B at the end of S72? Is that even an option? There's an A, D, and an S. According to my book, so we could get rid of both of those super quick, leaving us the only answer it could be. That's handy dandy. Yep, pick C and move on. But before we leave, let's go back to our 79. Is there any notes here we could put down from this question to clue us in the next time? I mean, we have the lateral. They took out the word humeral, right? They took that out and put in elbow. So we could put near this code, we're at the elbow, right? As a term for our humeral, elbow, to help us out, find it next time without doing too much. We could also write ORIF next to this one. Well, lots of procedures, don't worry, RORIF. All they're doing is a bundling kind of the words open reduction and internal fixation. We can do that on multiple codes, on multiple bones, on multiple areas of lots of people's body parts. So this one is just another example of ORIF. You being good, Chloe, and Magpie? I was just checking on the boys, seeing where they're at. I got one in the living room and then the rest went outside, so that's good. You had it in the closed one? Oh, no. Oh, no, no, no. Well, some people have an open fracture, but they have a closed treatment. Some people have a closed fracture, but end up having an open treatment. So you got to be careful with all that. It gets crazy. And they'll sure try to trick you. For sure. Reduction, Tammy. It's a reduction. They put the bone back into place by pulling it apart manually and lining it back up together. So take advantage of when you're in the exam and they sort of keep in order. So if you already finished anesthesia and you finished integumentary questions and now you're in musculoskeletal, and the next question, while you're in and doing the 6 questions for musculoskeletal, come up like this, where 2 of the codes are in the, neurology section in the back of the book, and then the 2 answers are in musculoskeletal, and you're still working through the musculoskeletal and haven't gotten to neuro yet, you haven't done your cardiology yet and stuff like that, then you'll know you can get rid of those 2. They're not going to be the answers. We're going to stick between these 2 codes. Let's go see what our differences are. So our 22554. If I can get there fast enough. It's so slow. turn these pages. What's our differences between these two? We've got, yep, we got interspaces. Yeah, we're cervical with the 22554 or 22856. No, look again, check your numbers. We've got 22554, which is underneath in its own parent code, an add-on code, but it's on page 162. And then our other code is on page 170. And they're both parent codes, so we're okay. One of them is cervical discectomy. The other one is same thing, but we have an end plate in it. So we have an add-on. Artificial. Yep. Yeah, these codes get crazy. There we go. I see end plate. So we're definitely at our 56. And what else could we do? General anesthesia. What else? We did the dissection. Yep. Did they have any other proper terms for anything? Today we had one. It was really cool. I'll have to go look and see if I can find it. The type of incision they did had a proper name. Like this Casper post were placed. I like the word Casper. That sounds cool. We had this Carrison router thingies, Rugers, whatever. They're probably not screws, but like divots that you bolt in to that end plate, and that's the proper name of whatever those, they're not screws, but rivets, yeah, that they put into that plate. So that's kind of cool. Anything with a proper name, I like to add to the CPT code because it's still going to have those. We did have fluoroscope included in this CPT code. Is that noted in the CPT code descriptor? That kind of stuff is always nice. Yes, you are writing end plate by that code for sure. Absolutely. By your 22856. That is super helpful. It's also complete. And you can write Casper or Carrison too. Those two proper names were used in this. Yep. This goes along with the, a size 1, 5mm interbody whatever device was placed under fluoroscope guidance. Yeah. That's like a fixation device. It's going to fix it into place with the end plate. Very cool. I love any of that kind of stuff. It all goes in, and AAPC will not change their vocabulary. So even if they switch up their question and change it, they're still going to use the same vocabulary that they did. It just may be in a different form, in different order. So all that stuff is really good to add. There you go, Betty. She's got it going on, all of it. I wonder where that one was earlier today. It's going to drive me nuts about the incision. I'll have to find it for y'all. It was so cool. They named an incision. It was like, how do you name an incision? But they did. All right, anesthesia. She's doing her takeaways. Anterior approach. If the fracture had been, or whatever they were working on right there, was on a different side, they may do the approach differently. So just be careful about the approaches. Usually, if the fracture of a bone, so we have a bone here, and then the fracture goes across the bone, you might do an approach either way. It doesn't matter. But if you have a fracture of a leg and the fracture only comes like this and down the leg, your approach to fix it might come in on the good side instead of the bad side. So it can alternate depending on what the doctor wants to use. Usually they use the good side of the body to do the approach and then reach the fracture and fix it on this side normally, but it depends on how it fractured, if it was green stick or whatever. But just know that your approaches can change on fractures, so be careful with that. It's not always the same approach. What is JP1? Hey, can you please go over how to tab? Don't tab your books, JP. They get in your way. If you're looking at these questions for your CPC exam or ahima exam, they're giving you numbers to run to, and you just need to go to the numbers. This book is numerically in order already. And if you tab musculoskeletal with a tab that says musculoskeletal, that's going to do you no good. It's going to waste your study time to tabbing your books. All my tabs are still right in the front of the book on the sticky page. They don't go nowhere. They stay right there. There's absolutely no need. You won't be indexing anything for the exam. The exam is already coded for you. You're just running to numbers to find the correct number is all. So that's not going to do you any good at all. And they're just going to get in your way. So don't tab your book. You won't need to schedule any one-on-one tutoring with me until your book is completely updated. You've practiced questions on your own, and you're ready to take your exam, and you want to see if you're ready, and then I'll make up my own exam for you, and then I'll let you do it in front of me, share some tips and guidelines if you get things wrong, or how to move faster through the exam if you're taking a little long. But you should have all your prep done, work, and ready to take your exam for tutoring with me. If you fail your exam and get a breakdown of how you did in each section, you can send that to me, and I'll create a tutoring session for you that will fix the lowest areas that you had so that you can go back and retake it pretty quickly and get a better score. Since you've already got good scores in some areas, we'll go over your lowest areas, bring those up, and then that way you can pass. So that's when you tutor with me, is when you're ready to take the exam. The learning part of all this, you should watch all my lives. I do them 3 days a week, free. You learn from here. I show you how to prep your book. You get all that done. You join our Discord group and get all your how do I do this and how do I do that questions answered. And get ready to take your exam from there. Let's see. If we're doing this one, I love all the zeros, right, guys? E&M is another bear. That is a big bear to swallow. Thanks, Annie. You tabbed your book. It won't help you for the exam, and they get in the way, but that's okay. Everybody tells you to do that, and it's the most ridiculous thing I've ever seen. It's all in your way. This is exactly how the exam's going to come. They're going to give you the answers. You just got to run to the answers, and those tabs aren't going to do you any good. Okay, sorry. Let's go to our anesthesia. What's our differences here? I would just get rid of A because it's got the 2-9, and I would keep these. So 0, 1, 8, 0, 1, 8. Don't worry. When I first started back in 2018, I guess, somewhere around there, I tabbed all my books because I did exactly what everybody tells you to do, and that's a waste of time. Those things were all up in the way, especially the diagnosis ones. Oh my gosh. That was a waste of time. 1810. All right. So 10, 30, and 40. We've got nerves. We got bone. And 40 ends in not otherwise specified. Is that going to be an answer? Not no way, not no how. You see how it ends in the words. The CPT code descriptor on 40 says not otherwise specified. I've not seen any answers ever come out of that. So it's going to be a difference between nerves and bones right here is what it's going to be. Look at Betty. What are you knowing? What are you knowing? Have I burst your bubble? And we're doing nerves. So nerves is going to be their answer. So C is our answer, right? Thank you for the follow. I hope I can help you out. Hey, Megs. I hope the connection got better. Total waste of time. Burned mine up. If you do, sorry, Annie, if you do tab anything, put your tabs at the top of the book up here, not here, because you need these pages free to run to those codes so fast. So there's a couple of places in E&M I'd like to tab, like where the wellness exams codes are. This page is difficult to find. I hate it. Where that standby services code is always difficult to find. Your critical care, my favorite code, the 991 code. And maybe those baby codes where the peds neonate. You know, some of the E&M stuff, I wouldn't mind tabbing the top of it where I could find it really quickly, but still rather just run to the codes because it's all there. It's all there. All right. Here we go. Hey, little Miss Heck, you can. I'm so interested in this. Aw. Poor Tammy having to take those things out. I'm sorry about the video pausing. It's 1 hour more to go. Should I stop the live, reboot the phone, and I can switch internet? I have two internet modems now, thingies, whatever. I'm on sudden drop right now. I could switch over to my other one and then come back and see if the connection's better. I hate for it to be freezing on y'all. You can't learn that way. It's good now? Okay. All right, y'all let me know. All right. Let's go to 989. Let's see. We've got a difference between the 2s and the 4s. So 98925 is our first one right there. What's that one about? What's going on there? How I would attack it is just split them up into 2 pairs and see what our differences are in these codes. I'd go to 98925, see what my header is, and then I'd go to my 98940, see what's going on there. We're in regions. Okay, good. I'm glad it's better. Okay. Oh, come on. What is our 40s? Got that. What's our 40s? There we go. So are we doing CTM manipulation or are we doing OMT? And we can see we're doing OMT. So we'll just keep our early birds and get rid of these older ones. Our differences between the 27 and the 25. We got 1 to 2 body regions, or we're doing 5 to 6. You have to be sure and not count your injections in this area. Only count your regions. So we've got cervical and thoracic. We have 2 regions. Don't count the shots. That isn't going to do you any good. That'll get you to the wrong answer. So only do the regions, which means cervical, thoracic, lumbar, coxal, those kind of things. Yep. C yet again is our answer for sure. Yep. All right. So this one, I love all the zeros, right? We do have 2 differences though. We've got the 2 4 3s and then the 2 3 4s. What's our headers related to all of that mess? Go back up here to the other side of the freaking book. 2 3 4 is under what header? 2, 3, 4, 3, 0. We're under the header of repair, revision, and reconstruction. Our 2, 4, 3s are also under repair, revision, and reconstruction. Ain't gonna do us no good, huh? Oh my. Sorry, I have to prep these questions ahead of time before the live, so I don't have any E&Ms up right now. I already did 3 an hour ago, but I will return back to those and do some E&Ms as soon as I finish with these musculoskeletal. 2, 3, 4, 3, 0. We've got some long tendons of the bicep. We've got a resection. So we've got stitches or resection, actually. And then our 3 4s, or our 4 3s, I mean, our 4 3s, 40, same thing, is attached distally. Yep. And then our 42 is a resection. Are we stitching or are we resection? So our squirrel ruptured their distal bicep tendon. Did we stitch it or did we resect it? I'm assuming we're stitching because if it's already ruptured, would we resect it more? What did we do? And sutures were placed on the tendon. So don't believe we're going to be in the resections. So we can get rid of our 42. Yep, we did stitches. And our 40. What's the difference between these? What's our differences? We got a long tendon of the bicep, or yep, what's our medical term for our stitches? For our place stitches. It's the SIS at the end, right? We're reattaching at the distal end. They went in and did a couple of incisions too. Correct. You got it, Betty. B is our answer for this one. Proximal end of radius is a good word match to put down here on this one because we're at the elbow. Super handy dandy to have that there. You can also write stitches or reattach distal. Reattach distal is what I have in my notes under that CPT code. Yep. All right, what have we got going on here? 20551. So the 20551 we can't look at. We got to look at mama code. Mama code is single tendon. There's usually an issue with extending out that tendon. It gets retracted, you know. Our 52 is based off muscles. We've got 1 to 2 muscles. Our 53 is 3 or more muscles. So let's see what we're doing. Our squirrel is grumbling about chronic arm and shoulder pain. They have reflex dystrophy syndrome. For our abbreviations, if you don't have that on the last page of your CPT book, which is the back cover, that might be a good one to make sure we have. They're trying to get you to note 6 trigger finger point injections so you'll catch something wrong. But the true information that you need, as usual, is usually the last few words. We have 4 muscles. Meaning that our answer is, like always, if we were doing the process of elimination, we would get rid of those 2. We would keep the answer that has the same code in both answers. Then we just need to know, do we times it or not? And because we're only doing 4 muscles, we know that our 53 captures all of that all in one, and we don't need to times anything, and wouldn't right here anyway. Trigger point injections are trigger points are made inactive so that it stops the pain in patients. Also, sometimes they don't call these injections trigger point injections. They call them TPI. They love their acronyms around here. So be sure you know what TPI means too. Trigger point injections. But it sounds more official if you call it a TPI for some reason. But yes, D is our answer. Ooh, don't freak out. Take it 1 code at a time. 1 code at a time, all right? Do we see any coding irregularities right off the bat? Something that would just be a no-no if you see it. Yes, Megs. Giggles, yes, I am. Good job, Shawnee. Yep. That A, or whatever that is, X, the X in the middle right before that A is weird. Yeah. So now, if you did that and then thought about the process of elimination, what are you going to be at? 27506. Let's go see what's going on with our 27506. So we're on page 198. We've got an open, and my notes say rotting, like RODDING. Probably just going to end up being a difference between these two things, right? What have we got going on? We do have an open. Femur shaft fracture. Yep. One's with an implant, and the other one is with a plate and screws. What did we do? We did the rodding. Yep, we've got the big rod that goes underneath there. So we know we're at the 6, most definitely. And with the process of elimination, after we got rid of our coding irregularity, it would have kept us here with these two anyway. My new cell phone notification thing is this 1980s drum beat. It's so funny. I'm laughing at it. What's the differences between our 1112 and our 1144? I know, where's Mean? She could be answering all these without us. We got debridement down to the bone, but what's the difference? This is debridement too, right? Oh no, Annie, that's terrible. Devitalized. Usually there's a difference between one of them is a fracture debridement and one of them is healthy skin debridement. Yep, so B is your answer because this debridement is only debridement that is with a fracture. You have debridement separated into categories of fractures, and then separated again in infected tissue, and then separated again in healthy tissue. Good job, Hannah. That's okay. Fracture is your key term. Yes. MD, assessed a squirrel for a thoracic curvature of the spine. What is that called? Yep, they are right next to each other. Be sure you have those debridements separated out into those sections. Fractures, infected tissue, and then the healthy tissue. Anybody agree with? Yep. Shawnee's got a different name. Not a lumbar issue, Shawnee. Thoracic curvature is your difference. So it's the K word. Insane, but it is the K word. So if you don't have that down, be sure and put that down on the beginning section of your musculoskeletal section, where I tell you to write the prefixes, suffixes, and your root words. On that skeleton man, somewhere around in those pages, be sure and write down the definition of that word. Yep. Which one does not mean bone? Good job. Oh, that's cool, Annie. I'm glad. That way you can write that one down. I'm going to have some time to do some E and M after this, so y'all can stick around. I'll just go get the questions. Which one does not mean bone? And don't be going to Google. What would you do if you were in the exam and you didn't have your cell phone? Do you know which one does not mean bone? Yep, OCC means occasional. You got that one right. Perfect. Nope, doesn't mean ocular. It means occasional. It occasionally happens, and it's a medical term, but it's just an acronym instead of, or an abbreviation actually, instead of a prefix or a suffix. So you did good. Did good. It just means occasional. Like occasionally give your patient, PRN, Advil or whatever. Yeah. True or false? Where is this muscle? Is it a muscle in the shoulder joint? No Google. What would you do? Do you know where this muscle is? We do have a page of all these drawn in pictures of muscles on the front of our musculoskeletal system. We do have them. Where is your latissimus dorsi? Do you know what page, where you would run during your exam? Good job. We've got this one, the S82. We've got the fastest way to get to that one and to figure out what the answer is to run to your S82. Don't go any further. You don't need those last 3 digits at all. You can get rid of those. That one's a coding irregularity because the X. But if you just go find out what your differences are at the S82, you can pick out your answer really quick with this one. And I drew this fracture in on my skeleton man too, by the way. I drew my little fracture dude right there for this question. Sorry, Bixby came up. I hate Bixby. Every time I touch this phone, Bixby comes up. We got K as an answer. I do have K as the answer. Good job. Which one means bursa or burso? No Google. Cartilage, bone marrow, pain, bag, or cartilage. What do they do when you have bursitis? It's an older term that they use. I have bursitis in my knee or in my shoulder. They usually drain fluid out, right? They do that arthrocentesis where they poke a needle in you, draw some fluid out of a bag. Yep, that is correct. Good job, Sky. Good job. It's actually in quotes, and you'll find bag actually in the CPT code descriptors when you're dealing with CPT codes for the bursectomies or bursts, whatever they're doing. So yep, it is our shock absorber between our tendons and bones. It's crazy. What does this one mean? I'm an old bag, and I'll not forget that one. You had to go to the index. Good job, Betty. I'm glad you found it. Nurse purse bag. Annie. All right, what's this one? You remember purse is like a purse. It's a purse bag. Aw. Very cool. It's squishy, spongy stuff. We all know that my means muscle, right? So we could get rid of autoimmune and maybe possibly friction, because the two that have muscle in it are these two. Are we talking about a weakness or movement? Yeah, weakness. All right, that's it. Let's go see what our E&M quizzy has in it and where I'm at here. Well, that's not E&M. That's not either. Let's go up and see if I can find some E&Ms. All right. E&M, we got established patients, obviously. It's usually not the 15 and not the 12. It's usually right in between. But let's check out our question, see what we got going on. Ooh, it's an ortho question. How fitting. That was so random. Both knees. Blood pressure, vitals are all great. Whatever. They did write a prescription for Celebrex. And they were here for knees. Why are they talking about elbows down here? What the heck? I thought I saw elbow. I did. No. There are... Did she say something? Thank you, Twinkle. All right. What level visit would you give her? Great, Jillian. Good luck. Best of luck. Best of luck. Best of luck. We do have a new prescription. We do. Let's see. Good job. We did do a 14. Perfect. I love this code. We've got our critical care code right here, right? 85 is what? Which one is that one? Well, they didn't manage her drug. They wrote her a new prescription, actually. Manage is when you come in, we evaluate all the drugs you're taking, your vitamins and all that stuff, and do your refills. So, brand new prescription. It was just writing a prescription. ER. Very good. Okay. What about our 475? What's going on with this one? B and C are a no-no? They are. Look at those 8s. I've never seen that as an answer in AAPC's questions. If I ever see 8s with an E and M, it's never been an answer. I don't know if it's true. I don't know if it's 100% true in coding, but they don't generally do lab or bill lab in a critical care situation or an ER situation. That's just separate, or I don't know. It's just never been a correct answer. What's our 475? So we would get rid of B and C. What's our 475? We are being asked to do the E and M for the ER. So do we do peds for 2-year-olds? Or do we do that one? She can't find it now. It can't be coded with the 99s. It has to be. I've noticed it being trending, but I'll look for that. I didn't know it was a guideline, but I noticed in doing these questions for so long, for a year now, 8,000 codes have never been an answer. Nine, 4. Da-da-da. Da-da-da. Okay, the 475 is initial inpatient pediatric care but it's inpatient. That means in the hospital, admitted. They asked us to do the ER charges, not inpatient services. And that's why I believe the answer ends up being A. Even though our 475 does 2-year-olds through 5-year-olds, it's just the variation that they asked us to do, the ER doctors. Correct, Walker. Good job. Good job, Shawnee. Betty's still stuck on the Celebrex question. Correct. When she returns and she asks for a refill, but it could be more, it really needs, prescription drug management is where you go through and you check their vitamins, other over-the-counter meds that they're taking. It's not just a refill. It shouldn't be, but it can be. But you could come in and ask for your Claritin refill, which is over-the-counter, and get your 214. It's insane. But what they're supposed to be doing in the prescription drug management clinically is checking all your over-the-counter meds, all of your dietary, because like if you take Coumadin, you're not supposed to eat like spinach because it affects the efficacy, there we go, of Coumadin in your blood level, and it could throw off your lab results. So when you're doing prescription drug management, you're supposed to talk to them about all things vitamins, medication interactions, including dietary interactions that could affect that. Do they do it? Not always. Proper administration of the injections too. Did you know you're not supposed to shoot your allergy meds that are the nasal pump sprays directly straight up your nose? They're supposed to go in at an angle towards the other side of your face. So if you're on the right nostril, when you put the nasal inhaler in your nose, you're supposed to point the tip towards the left side of your face. That kind of stuff is what they mean by prescription drug management, but that never happens anyway. Yes. Vitamin K. Yes. Coumadin. Yep. Write it all over. Oh, I'm sorry. I know, it's playing the little drums is driving me nuts too. But I got tired of the other Verizon alert. It's just a nightmare to listen to that too. So this is a little easier on the ears. Yep. We're off talking about Coumadin. All right, new patients. So we got a difference between a level 3 and a level 4. So let's see what's going on with our patient. Oh, Lord, I've already got chest tightness. All right. Blood pressure. EKG ordered, CBC ordered, chest CT scan ordered, and a prescription given. What are we doing? Oh my gosh. Y'all, I got 2 phones to turn in. Y'all are killing me. Yep, I think so too. And then it's a difference between a psych diagnosis or a symptom diagnosis. This is what the doctor said. I've done this one before. Chest pain consistent with anxiety. Are we choosing anxiety or are we choosing chest pain? Get off of YouTube. Get off of YouTube. I'm here. I'm caring about you. Get off of it. You ain't looking at it. James, you better not be on YouTube. Do you hear me? Can you take out the trash? Did you do anything around here? Did you do any chores at all? Oh my goodness. Sorry, I just had to yell at the kids. They're sitting around both on YouTube unsupervised. Not supposed to be like that. So yes, Betty, you are correct. Oh my gosh, I've been so quiet the last 2 days, but my freaking phone, I broke it twice this week. So this is the new phone. Here's the one I got to mail back there, and here's the one I got to mail back here. So I got 2 to mail back, but I've had to reset every password, every logon 3 times this week, and yes, I'm going insane because of it. I hate it. But yeah, I keep dropping my cell phones. This one isn't bubble wrapped yet, but you can't really bubble wrap these folding screen thingies because there's screens everywhere. I just have to be careful. I got my little poppet to hold it, and then I got one little thing on it, but yeah. I had the other one for a year, and it didn't break until now, but I've just had some bad luck with it. I keep dropping it. Bad things happen in threes, right? So I've only got one more to go during my birthday month. We'll see. Hopefully. Yeah, well, you can't put an OtterBox on this one because it folds. They don't have such a thing. I wish they did, but they don't have one. Yeah. If y'all have not joined the Discord group, y'all, look at that. Oh my gosh, Betty, you are hysterical. How do you find those? I can't even find them. My Discord group is great. That is our normal chat room. Then we have all these other chat rooms. If you want practice questions, they're right there. What to expect on exam day. Even down to other CCS, you've got your own room, risk adjustment, compliance, CPT book prep. You get to see how I prep mine, what to do with it. But there's also, you can sell your books, who we've helped, and off topic is fun. Job placement. There's tons of stuff in here. Where is our job room? Do I need to hit the plus sign again? Sometimes some of the channels go away. I don't know. I need to add some more rooms. I know Betty's got some things to add. I need to do like how to navigate Discord or something. And then like welcome, go here first. And then we'll show you how to navigate this channel or whatever. But I need to do that too. Yeah. It lights up. All the ones that are lit up have messages in there for me, and then the ones that are lowercase that aren't lit up means you've already seen everything that's gone on in that room. So all those rooms I got to go into, but super cool because you've got all these resources. And look at y'all. I tried to change y'all's names. I think y'all changed them back. I don't know. But Betty's in there, Twinkle's in there, everybody's in there, Auntie CC. Quite a few people in there to help you out when I'm gone silent and working on these books, but super helpful group. Tons to look at in there. We'll help you along your way for sure. There's our answer for that one. What have we got? What E&M visit and ICD dying codes report for what? Oh, that's for another case. A different case. See, our answer was that one. Yeah. And then I've got this next one. So we're at the 8-2s, the 8-3s, the 8-4s, and the 8-5s for this question, which means you better get out your history, you better get out your exam, and you better get out your MDM, write down your codes for each one, and then figure out if you're 2 of 3, 3 of 3, and do all your stuff. What do y'all think on this one? We have expanded problem-focused history. We have detailed exam. And we have a moderate, MDM of moderate complexity. Yeah, but we've got an expanded problem-focused history, which is not the same as a moderate. You can't just pick moderate and run with it when you have something that all 3 of 3 need to match. What is our expanded problem-focused history get coded as? We're at 99283. Ooh. That's an 82. I haven't gotten to the codes yet. Take your word for it. 82. What does our detailed exam get us coded at? Not much, okay. I got such blurry vision right now. I've been looking at the computer screen, the book, and the cell phone since 7 this morning, and my eyes are done for the day. All right, detailed goes with our 83 does expanded problem focused, right? So does 82. So 83 does it too, right? Expanded problem focused history. Yep. So we can write down 2 codes for that one. And then our detailed history is in this one. It's 84. And then our moderate MDM is our 84 and our 83. 84 and 83. It's in both. So if all 3 have to match, what are you going to code? Expanded problem focused history is in 83 and it is in 82. So we can build the 83. Miss Betty. Why can't we do an 83 if our history is expanded problem focused also in 82 and 83? Right there. Expanded problem focused history 99283. Expanded problem focused history. It's there and it's also in the 82. So is our moderate is in 2 places. It's in our 83 and then it's also in our 84. So they're just yes, history forces you to be at 83. Indeedy do. Indeed. 99304. We're under nursing facilities. We're either subsequent nursing facilities or we are newer established. Newer established. It doesn't really matter. So what are we doing? They were admitted last week. Returns for a follow-up. I know. Maybe they couldn't hang out. It is kind of late on a Friday night. Subsequent or established. That's very tricky, isn't it, guys? There's more of a difference here. These are for the evaluation and management. Oh my gosh, my phone. Requiring 3, and these are requiring 2 of 3. So these are 3 of 3, and these are 2 of 3. Oh no, all these rabbits and squirrels. It gets confusing. We've got an expanded problem-focused history. We've got a detailed exam, and our MDM is low complexity. Low complexity is with 08. Our expanded problem-focused is also with 08. But detailed examination? That's in 09. But since we're only 2 of 3, we can get rid of the exam and we can keep them at the 08 level. Since we're 2 of 3. Dr. Travis. The rabbits are the doctors here, and then the squirrels are always the patients. But that makes sense. Two, 3, 4, 5, 6, 7, 8, 9, 10. 10 organ systems. I see what you're saying, Mona. Yeah, the answer, though, that AAPC is wanting is simply just the 08. And it's okay to exceed what is required to code something as long as you're not lowering or upping the code for no reason. But you've got to have all 3 match. They may have done 10 organ systems, but their history was expanded problem focused. So you can't get past an 08. You can't go higher than. You can examine all you want, anything else, but you can't go higher because of that history. And our MDM is low too. We had a low complexity on the MDM. Critical care is our 25 cc. That one just looks abnormal because it's not even an E&M. What's our 99466? 84 is ER, right? ER. What's our 9466? 466, is that our baby peds or something? Hospitalization, something. Don't know. 466. Is it critical care for babies? 466. Critical care, face-to-face, during interfacility transport. So we've got transport here. We're moving them. We don't want y'all. We found you a bed somewhere else. Let's get out of the building. So our squirrel was in the emergency room, and Dr. Rabbit performs 45 minutes. CPR, puts in a central line, and intubation. What are we going to bill? None business. That's cute. I got 2,000 hearts. Thank you guys. That was really sweet. What are we going to bill? 28-day-old. Correct. We got our A. Very good. What about our established new patient right here? Look at all those codes. And looky there, we got some 8,000s in there. Didn't we say we're not going to have any 8,000s? We got some 8,000s, whatever, with these 9 9s. Let's see, we got new or established. To see her pediatrician. So let's boot out, let's boot out her new patients. And let's do the office visits. So those are the same, those are the same, those are the same. We've got just a difference between the diagnoses. Are we R1110 or R112? Diagnose the squirrel with dehydration. Not in the ER. They both have symptoms. and it's not always, the proper coding answer. It's which of the answers here are the best for the scenario, right? Not symptoms, yes, symptoms. And we have 8,000 codes with it. It's what a mess. What a mess of an answer and a question, for sure. Travis, is that you throwing stuff, boy, all over again? I've already done that one a ton of times. What have we got going on with these? 2, 3, 1, 3, 2, and 3, 3. We've got a heart attack the last 2 days ago. Was out of critical care. Oh my. So it looks like we're doing sequel or subsequent. Yep, subsequent hospital. So you follow along your lines. What is our history? We've got detailed, our problem-focused examination, and our MDM. Are we 2 of 3 or 3 of 3? A. 99233. Where are we at? Let's go see why. 99233. 99233. Let's go see. Let's go see. What did we miss? What did we miss? 233. So if we do our, where am I going to write this? Let's see. We've got our history, which is detailed, right? We're 2 of 3, so don't forget to throw away your lowest. Detailed goes with 3, 3. Right? Our expanded problem-focused exam is 3, 2. And then our MDM is high, which is our 3, 3 again. We can throw away our lowest if we're 2 of 3 and just code 33, which is A. Because we are 2 of 3. We are not 3 of 3. We are 2 of 3. Got it? Don't forget to pay attention to whether you're 2 of 3 or 3 of 3. If you're 2 of 3, you can throw away your lowest and bill the lowest off of the 2 remaining, and they matched. So we just billed 33. You okay? Correct. All right, guys. I hope that was helpful. We have the male and female genitalia workshop on Sunday, 3 hours. So if you haven't gotten in on that, I've already sent out the link with the Zoom meeting link to everybody that's already purchased, so check your emails. I sent it out a couple of times yesterday and then today so that y'all would already have it, but I'll keep sending it out. We'll be on Zoom for 3 hours, 2 o'clock Sunday, my time in Arizona. That means 5 o'clock New York and Florida time zones. And we'll do 3 hours of no conversations or stories, but just back-to-back questions and answers and how I would attack each question for male and female genitalia and all the surgeries. We'll do some diagnoses and some E&Ms on that one too, but mostly the CPT codes in that section, some vocabulary words that are attached to that, how to find the answers if you don't know, and some guideline information about that section for modifiers and that kind of stuff. I will, Shawnee, as soon as I finish that section up. I haven't done that one for book prep. I'm doing musculoskeletal right now. Then I'll do lab and path, and then I'll do medicine. And then we've got the rest of the year, as soon as I finish those 3 sections, to do any kind of section y'all want, of course. I just need to get my books prepped. I have last year's prepped, but it's fun to show y'all the cool stuff as we're doing workshops. I can show you the books and what I've done. So, yep, I will. I'm working on it. Need to do some book prep tonight. Y'all haven't seen much of I don't think I've done any of the musculoskeletal book prep. I have some time tonight, so I'll get off here and make sure the kids are not on YouTube and are going to bed, and then I'll be back in about 30 minutes, and I'll be sure and record a live on YouTube. So I'll go live on YouTube, and then y'all can watch me prep the books tonight on musculoskeletal, because I'm putting some cool stuff down on that one too. So I'll also repost this live on YouTube so y'all can have it. I don't have any tutoring tomorrow, but I do have tutoring on Sunday with the workshop, so Sunday's going to be crazy. Tomorrow I was planning on taking the kids out and doing something fun with them, but my mom messaged me a few minutes ago and said one of my cousins, I was talking to one on a couple of the TikToks lives this week, but it's a different cousin, but I haven't seen them since the 80s, probably 1980s. Anyway, my mama's baby sister, Aunt Candy, who used to be the world champion baton twirler back in the day when she went to Ole Miss, Mississippi Community College, Memphis State. One of her baby boys and wife are traveling in a trailer through here in Vegas tomorrow, so they'll be through about 2 o'clock. So I don't guess I'm going anywhere with the boys. We'll be here, but it'll still be cool to see them. I haven't seen them since the 1980s at all. They ate the inside of Aunt Candy's car when they were kids. I mean, literally ate the inside of her car, like the seats and cushions and everything. It was crazy. So he's a doctor now, so he turned out all right, but she just, she was a passive lady, and she just said, well, maybe they're just missing a mineral. They needed whatever was in that car. They ate it. They ate the entire side. Yeah. Anyway, it was insane. So when we're kids, we do the weirdest things, don't we? So, yeah, I'm sure they have stories about me. So that was cool. They've turned out to be physical therapists and a police officer, the 2 cousins. So they turned out okay. They did. They're wonderful, much better than I turned out. So they're wonderful people, and it'll be neat to see them since they were little bitty with their little snow boots on that changed colors in the snow and rain. Was probably the last time I've ever seen them. They moved from Memphis to Tulsa, Oklahoma, and every time we've ever visited, they were either away in Iraq or off to med school or something. So I haven't seen them since the 80s. So He turned out all right. He did. We were worried about him for a while. Aunt Candy was so cute. They were giving away a car sometime after that, since they ate the entirety of the inside of the car, upholstery and all that stuff. But some car dealership was giving away a car, and all you had to do was come in and fill out a entry form and put it in a drop box. Well, she sat there every day while they were gone to school and filled out probably 10,000 of those things with her name and address, and they let her. And of course, they pulled the car. They pulled her name, and she won it. So when she got the next car, they didn't eat that one. So that's good. But that was cool luck. She's also was at Graceland when she was in college. Like, she got to go to Elvis's house and play frisbee and stuff. So she's led a very interesting, fun life. Her boys are her world. My strange addiction stuff right there. I don't know. It's like, maybe it started and they were just really picking at it, like bored and picking at the car seats and pulled the upholstery out. I don't know. But they sure did. It's just it's probably overblown story or a wives' tale now at this point, because we're all in our 50s, but it's fun to tell, Anyway, so they'll be around tomorrow, and I'll check it and look inside the camper and their car, make sure they haven't eaten the inside of it too. So I'll let y'all know. But they're traveling across the United States with their dogs and having a good old time this summer yeah, cousins are the best stories. Yep, I didn't have any brothers or sisters, so I get to pick up on the cousins. My dad's an only child too, so we're all just fascinated by my mom's side of the family. All right, well, I'll be back in about 30 minutes. We'll do some musculoskeletal book prep, and I'll see y'all definitely on Sunday for our workshop. And let me know in the meantime if y'all have any problems or issues. I do have my phone mostly working right now. I got the email addresses linked. I've got the website logged into there and Discord up. So I just got to catch up on the last 2 days worth of messages, because I was breaking and switching phones like nobody's business. So I'll be back on soon, guys. Thank you so much, Twinkle and Betty, for all your help. I hope this has been helpful, and I will see y'all again on Sunday, if not in just 30 minutes or so. Good night.